Welcome to Encounter, where we celebrate putting faith into action and community leaders who live out compassion, grace, and love. We're a program of the Broome County Council of Churches that addresses food insecurity through chow and the Greater Good Grocery, provides hospital and jail ministry, builds wheelchair ramps, and assists neighbors with transportation and shopping services through Faith in Action volunteers. We invite you to the conversation. Encounter your neighbors as we learn to walk together in love and kindness.
Good morning and welcome to Encounter. I'm your host today, Joe Sellepack, the Executive Director of Broome County Council of Churches. Public health is one of those interesting subjects that kind of come up on whenever we have like a pandemic, like what happened in 2019 to 2020, and also at various times as we begin approaching issues like vaccinations and other things like that. Public health is really a very important part of what government's relationship to the public is. And so to help me talk a little bit about public health, vaccinations, why they're important, other kinds of things, is Connor Lawless. Connor is the director of health for
Health Program Director.
Health Program Director is his title. He works with the Department of Public Health for Broome County. Welcome to Encounter today, Connor.
Yeah, thank you for having me, Joe.
So let's break that down a little bit. So what is public health?
So public health is where where a primary provider looks at their one single patient, we kind of look at the community as our patient, figuring out what health issues are going on in the community and trying to address those at a more community or public level.
And what would some of those issues be?
So things like lead poisoning, where we inspect homes for lead paint and address issues, help families who have children who've been exposed to lead, work through on reducing that lead level and remediating that home to get rid of lead from the environment.
And why is that important?
Well, it's important because lead poisoning can affect children and cause developmental delays that can last a lifetime.
Right.
No amount of lead is safe, and so any kind of exposure is something that we want to decrease and avoid.
What happens to children when they're exposed to lead?
So children who are exposed to lead, the symptoms can vary. Anything around 3 micrograms, and I know this is a very jargony kind of term.
It's just very small amount.
Yeah, very small amount. If you want to think of it in like another way of framing it, one banana in an Olympic-sized swimming pool, or a packet of sugar across a 2-story home, that little amount of lead is all that it takes, and that can cause things like speech and hearing delays, difficulty communicating, aggressiveness, difficulty focusing, difficulty concentrating, some pica-like behaviors. And these things can match things like the ADHD-like symptoms.
Well, yeah, I mean, that's exactly what I was thinking when you were talking about it. It sounds like ADHD a little bit.
Yeah, there is a lot of studies that show associations between ADHD-like symptoms and lead poisoning.
Lead poisoning, very, very interesting. And so you would be the people that would analyze the lead concentration within a home?
So what we do is every day we receive the blood results for all the children who are tested in Broome County. And then we look at those results to make sure that they're not elevated. If they are elevated, we reach out to those families, provide them education on what their next steps are, and also set them up to get an inspection for their home.
Great. And so you're really thinking about, like you said, the community as a whole, and trying to figure out how to make the community as a whole healthier.
Yes.
And there's a lot that goes into that. So a lead abatement would be one, but then what would some of the other issues be?
So some of the other ones would be like communicable diseases, where things like
COVID-19.
Sort of like COVID-19, yeah, and other diseases, or vaccine preventable diseases.
Yeah, and vaccine preventable. And those kinds of things are very, they're very communicable, and it creates an environment where people can be exposed to diseases that that could kind of spread through a population, right?
Absolutely, and especially if you're unvaccinated or there's unvaccinated communities. These diseases can spread very quickly through them.
So this is really an interesting question. I mean, I don't get to often talk to a public health person. How did you get involved in public health? And why is it really like what piques your interest and creates like a sense of purpose and really calling for you?
Yeah.
I mean, you want to?
So I took like kind of a roundabout way of getting to public health. It wasn't my initial goal in setting out was to be in public health. I come from a rural area in upstate New York, and I'd wanted to go into rural health, be a rural health provider. And then while I was in school, the pandemic hit, and I kind of realized that I needed more experience within a community and getting that community level experience, that public health level experience, rather than just the individual.
Now, it takes a lot of education to get to that point, right? Like, what have you been through? Well, like,
so I graduated from Binghamton University with my master's and undergraduate. My undergraduate was in integrative neuroscience, which is essentially just looking at the mix of biology and psychology. And then I got my master's in biomedical anthropology, which looks at how culture, behavior, and societal factors affect and directly play into our health and presentation of health.
Yeah. And so, like, when you think about like what are some of the factors that are at play within public health for Broome County specifically? What do your thoughts go into at that point?
In terms of
like poverty, other like
I would say like it draws back to the social determinants of health and social and behavioral, I will say, determinants of health, where it's exactly what you mentioned. Poverty is one of the most talked about issues, housing and housing security and affordability, and also anxiety and stress. A lot of our residents are expressing concerns around those kind of
now how does that like bubble, like you're talking about the social determinants of health. That's a loaded term, for a lot of people. Like what are some of those determinants, and why is that important for health?
So things like poverty is going to affect how you can access health care. Your availability to, say, access transportation to get to that healthcare appointment might have affecting what insurances you have available and what coverage you have available. Your copays, what procedures you can actually afford and things like that. Poverty would also just be a barrier in a sense that, just a general barrier to that health. So it kind of snakes its way through multiple avenues.
Does it affect vaccination rates?
Absolutely. Well, it does. Maybe not poverty. Yeah, it does. There are programs in place. Like we have the Vaccines for Children program, which offers free vaccine. Well, at cost. Oh, sorry. Let me think here of how to just want to phrase that properly. No cost vaccines to families.
Right, and that way. Well, let's talk about vaccination rates. So, I mean, this is Vaccine Awareness Month, right?
Yep.
Month of
August is National Immunization Awareness Month. Yeah.
So let's talk about vaccination as a public health issue. So you had shared when we were talking earlier that it requires 95% of the population in order for a community to be considered safe, right?
For measles, yes.
For measles.
Yeah, the population needs to, or the community needs to have a vaccination rate of around 95%. At that rate, there's enough coverage and protection to stop that measles virus from really spreading throughout that community. Measles virus is one of the most infectious diseases that we know of. If you stick one person who's infected with measles in a room with 10 people, 9 of those 10 are likely to end up with measles, which if there's a scientific term that we use called R0, which it has an R0 value of like 18, which could potentially infect up to 18 other people just from that one person having measles.
And that's just one vaccination amongst a slew of others that are probably even more highly dangerous than measles. Is that correct? Or
Well, MMR isn't just one dose, there's a series for it.
MMR, yeah.
Because it has the measles, the mumps, and rubella vaccine that is involved in there. And there are some, like hepatitis B, that birth dose that children receive is one of the most effective vaccines in preventing those long-term health outcomes. So the statistic that I like to use is that children who are born to mothers or persons who have hepatitis B who are positive for it, those children have a 90% chance of developing a chronic hepatitis B infection. A 90%, that's a really, really high chance. And then of that 90, 1 in 4 of those children will likely pass from that illness. So that's entirely preventable.
What are like, I know that we use these terms like hepatitis, mumps, measles.
Yeah.
Like you just described a little bit about what goes on with measles, but what about hepatitis? What are some of the long-term results of being infected by that?
So hepatitis, for those who aren't aware, HEPA just means like liver related, and itis is inflammation. So hepatitis is inflammation of the liver. And these long-term effects that it can cause are things like cirrhosis. It's associated with liver disease, liver cancer, and those kind of long-term liver complications.
And so when we're vaccinating children and we're trying to keep children safe, it's not just a complication for parents, right? This is something that really does have much bigger consequences than just the inconvenience of sticking your child, right?
Yeah, that little poke is giving them protection that lasts them for years on end. For most vaccines, for years, that protection will stand. And
there's been a lot of talk about the effects of vaccinations and a lot of misinformation that kind of comes out from that. So what are some of those things that you all deal with in public health?
So I want to define misinformation here, where misinformation is right now kind of generally known as any piece of incorrect, infactual, or misleading piece of evidence that is not up to date. Basically, that's not accurate according to the best available evidence at this time. And that's like a kind of a loaded way of saying that, like, you want to have the most up-to-date information and the most current information. So like, it's also important to know that anybody can be misinformed and anybody can misinform others. It's just important to have that most up-to-date piece of information. So we deal with that a lot, working through some hesitancies that parents and people have over vaccination.
Yeah, my guest today is Connor Lawless, and we're talking about public health, vaccinations, and why these things are important for a population. And so, when you're thinking about communicating to a parent why vaccinations are important for their children, what are some of the things that you focus on?
So we really recommend people to talk with their providers about a lot of these issues, because their providers know their health the best. And studies show time and time again that parents trust their providers the most, and that's the source of information they're going to go to for health information. So we recommend, if you do have any concerns or hesitancies, go to your provider and just ask those questions. Nurses are another really, really trusted source. You can look at KFF polls, which is just KFF. They're an independent health source, which is some great information there.
What is that, KFF?
KFF, I actually don't know off the top of my head what it stands for, but they are an independent health information source. They release polls very frequently on various health topics, but specifically they have a section on immunizations and health misinformation.
And do we have a current immunization rate for Broome County?
It would depend on the vaccine, but those numbers we could probably find those numbers.
Yeah, and so does the health department issue a report on that, or is that just something that that they use just for their own benefit?
I'm not sure if we do publish the rates of vaccination for our county. They might be in our annual report or in our CHA, which is our community health assessment, which we release every 5 years.
Right.
But that data is available on the state. It might just be a couple years behind.
Yeah. We use at CHOW, and whenever we're putting together some of the stuff on the social determinants of health for food and food as medicine and other kinds of stuff like that, we use a lot of the data from the public health department. It's interesting that all of that stuff is readily available. You can kind of look at even disease rates and other kinds of things like that. So you can find out, for instance, how many measles cases we've had in Broome County through that document, right?
Yeah.
And really, I mean, what we're talking about here, especially for people who are vulnerable. So you have incredibly, you have people who might be healthy. They may be resistant to a lot of the severe outcomes of a disease, but then you have really vulnerable people who you're trying to protect because they can't get the vaccination, and so this is part of the struggle, right? That you kind of deal with. So like why should people really be concerned about vaccinations and vaccination rates within their community, and why is this important to you as a public health worker?
So this is, I'm going to try and take this question, just branching it through. The reason why it's so important is that, I mean, vaccines have almost worked too well.
Right.
Right. Like we're now seeing like such low rates of disease in the last few years that now people have forgotten what these diseases were really like. And I mean, I can't even speak on it because I have not personally seen those effects of like measles in a patient.
Right.
And there probably aren't a lot of providers in the area that have actually seen those kind of vaccine preventable diseases in this area. Probably a select few, because of the success of vaccines in preventing those diseases from being spread. And today, these last few years, we're starting to see that kind of consequence of hesitancies toward vaccinating and this reluctancy to vaccinate.
Right, right.
Through these outbreaks of disease, through like this measles outbreak that we've been witnessing in the United States over the last 2 years, which mostly stayed out west, but has now started to work its way into the Northeast. Yeah,
and so like polio, for instance. Like I'm a Rotarian, and polio is very important to us because we have made it part of our mission to eradicate polio, and we know that through vaccination, we can keep polio rates very, very low. And currently, there are only 2 places in the entire world where polio is active, but we forget what it's like to have polio, right? I mean, that's part of what you're talking about.
Yeah.
Like, and like, what are some of the effects, like, when you're thinking about how bad that is? Like
polio, there's the paralytic effects that it can have, where it can really, really affect the nervous system, and I mean, you have those, like one of the most famous examples with FDR.
Right.
There's a reason why a lot of his photographs were always seen with him sitting down, and it's because he had trouble standing, because he had nerve damage and from when he was a child and had polio. So there's that aspect, but it's.
But there were people in iron lungs.
That's what I was going to get into. Yeah. So like, someone had just recently passed away in the last year or 2, where it was like one of the last patients in an iron lung or something like that.
And the reason she passed away is because they couldn't find anybody who knew how to repair it.
Oh, that's horrible.
Yeah, and the idea that we want to somehow revert to a position where we don't vaccinate is mind-boggling to me. So,
but I do understand. Like, I try to come from take things in a very anthropological perspective. Like, I very much so try to understand why people believe the things that they believe in. And I try to take a very empathetic approach to these conversations. Like, it would be awesome if we could have those vaccination rates where they are. But, you know, historically there have been some experiences that groups or people have that might dissuade them from trusting sources or the government or certain initiatives. So we can understand that through either whether it was historical trauma, medical racism. Some groups can have their beliefs on that.
Yeah.
Or it's, you know, their own personal experience. They felt how the pandemic was handled was not done well, or they were just looking for information in an information void. And they were just trying to find anything that they can to make sense of the situation around them.
Mm-hmm. Now, like smallpox, that's another one.
Yeah.
That's pretty much been eradicated.
It has been eliminated from the United States. So
from the United States. But we don't often see the effects of smallpox. Like do we still vaccinate for smallpox?
Not in the U.S. because
not in the U.S.
There's really no reason to. There's no disease, and that's I'll tie that into a large part of why we vaccinate is the risk of that disease. So with smallpox, there really isn't that much of a risk for the United States population, so we don't vaccinate for it. Other vaccines like meningococcal or things like pneumococcal, those ones also have certain age groups or groups that they target because the risks are higher in those groups compared to others.
Right, and each one of these, like whenever we're using these big, the terms pneumococcal or other kinds of things like that, those are diseases that have significant outcomes if you don't vaccinate, right?
Yeah, and those significant health outcomes that can be prevented. And that's the huge part is that, you know, these vaccines aren't going to stop you potentially from getting the illness. But what it really is trying to do is stop you from ending up in the hospital or ending up dead from that disease.
Right, and so that's where the flu vaccine comes in,
yes.
Correct? And other kinds of things like that. So why, oftentimes I'll hear someone say, well, you know, I don't get the flu vaccine because, you know, I don't want, because it usually gives me the flu or, you know, any number of other things. So why should somebody get the flu vaccine, do you think?
They should get it because, you know, like I just said, you really want to prevent that hospitalization, those worse outcomes that can happen. You could still get the flu after getting the vaccine, not from the vaccine, but just from the virus being passed around, because the vaccine doesn't have the live virus in it. It's an inactivated part. Really, it confers that protection. So you're protecting not only yourself to prevent yourself from getting those worse outcomes from ending up in the hospital, but you're helping to protect your community. And like you had mentioned earlier, you're helping to protect those who might not be able to get that vaccine because let's say they're allergic to a component, they're too young to get it, or they have some other medical complication that doesn't allow them to. You getting that vaccine helps protect your community at large.
Yeah, and you're also protecting medical workers. You're protecting.
Absolutely.
There's a lot that goes into actually accepting a vaccine. Now, one of the other aspects of the vaccinations is that some of them are for life, and then some of them are for like the flu vaccine.
Almost seasonally,
is a
right?
seasonal kind of thing. Can you break that down for people?
Oh, I can try to. So for I'm just trying to go through my head right now and see which ones. Mostly flu, COVID are going to be like your seasonal vaccines, and then like things like Tdap, which is your tetanus, diphtheria, and pertussis vaccines. Those ones, like the Tdap, you need every 10 years. So there's a few that you might need a booster for. But for the most part, a lot of those vaccines confer protection for years on end.
Yeah, and those and really, I mean, you want to protect your children for their life. So so like hepatitis, the hepatitis vaccine that you give them, you only give it to them once, right? Or do you have to give them boosters as well? That's
either a 2 to 4 dose series, depending on when that child receives it, the first dose. So like, it also depends on whether the mother tested positive for hepatitis B. but for the most part, it's a 2 to 4 dose series, and that's like one of the first vaccines that children will usually receive. That's that birth dose.
Now, one of the things that I've always found, and you're not the first public health person I've ever talked to, but is that you're cautious. You're very cautious with your not only with your diagnoses and what you're talking about, but also with data and other kinds of things like that. Why is it important for people in your profession to be that cautious?
Because getting it wrong can have disastrous consequences.
Right.
And I think what we've seen during the pandemic as well is that not kind of telling that full, like not being cautious a little bit and having, or just not filling up those information voids can lead people to kind of try and find out their own information, go in their own sources and their own pathways to figure out what they want to know. So we try to just keep our information as accurate as we can and really make sure that we're putting out what should be put out.
And it's interesting, you know, that the other word that comes to mind when you think about this is careful. And really, I mean, when we're talking about care, we're talking about health, and we're talking about how we treat each other. Carefulness is a virtue. It's kind of cautious. Cautious is a way of approaching data, but carefulness is how we approach each other.
Yeah.
And really, I mean, what you all are like, especially that, you know, this is a program, the Broome County Council of Churches. We talk about loving your neighbor here, right? So it's important for us to, you know, to be able to have that carefulness aspect to health as well, right?
Absolutely. I really couldn't agree more there. And it's just so important to take more of an empathetic position when we're having these kind of health conversations with people. You never really want to discredit someone's own world experience. But again, just tying that back to, there are reasons why people believe in the things that they believe in, and really just trying to understand that further.
But this is National Vaccine Awareness, or
National Immunization Awareness Month. Yep.
Immunization awareness, because that would imply that the vaccine has already been given. So Immunization Awareness Month, and my guest is Connor Lawless. He works with the health department, and trying to help people understand why it's important for people to be immunized, and why it's important for all of us that we enter into that together. Yeah. Thank you for being on today, Connor.
Absolutely. Thank you so much for this opportunity. I really, really appreciate it.
Well, it's great. And for all of you, I pray that you would be careful with each other, that you would be kind to each other, and that you would be generous with each other, and have a great Sunday.